All right, I'd like to call the November 9th, 2023 Health Committee meeting to order. We have 4 members present, so we have a quorum. We have a consent agenda. Do I have a motion? Motion by Johnston, second by Hanson. Any discussion? Hearing none. All in favor? Aye. Any opposed? Okay, consent agenda is done. Do we have any members of the public today?
We've had no requests by members of the public to speak.
Thank you. Moving on to departmental matters. First up is Jason Tabb, Juvenile Detention Superintendent.
Good afternoon. You have my report in front of you. I'd be happy to answer any questions if you have them.
Are there any questions from the committee for Mr. Tabb? No? Thank you.
Thank you.
Oh, and Member Byrne came in. Yeah, thank you. I did say we had 4 members here, didn't I? Next up is Cassie Alexander from Advanced Correctional Healthcare.
Hello.
And you have your report. Is there anything you'd like to say about your report or point out?
No, but I'd be happy to answer any questions.
Okay, questions for? Go ahead.
I think this is more a comment, just we brought it up I brought it up last month as well. The increase that we saw in August in medications for the psychiatric, it kind of came back down to normal, and it seems like, and maybe you can confirm it seems like maybe it was just a particular set of the population that had a higher need at that point. Because the current numbers that are in this report show that it goes back to the normal level of medications.
Yeah, I would have to get back to you on that and really be able to look at the numbers and see what actually happened. I mean, there could be quite a few different answers to why that happened.
Yeah, looking across a couple of the charts that you provided, which I'm very grateful that you do, there's also a significant bump in August in the counselor visits, and then that seems to have come back to the normal level as well. So I took that as a particular set of inmates that are not with us anymore. So you're not sure?
There could be quite a few different reasons for that.
Yep.
We can get back to you on the exact reason.
Okay, all right, thank you.
Anyone else have any other questions? Okay, thank you.
You're welcome.
Next is Jessica McKnight, Health Department Administrator.
Hello. Hi. So you have my report. Happy to answer any questions and also take just the moment to promote our walk-in flu and COVID vaccine clinic that will be happening at the Health Department next Friday, the 17th, from 8:30 to 3:30. So again, it's a walk-in clinic for both COVID and flu vaccines.
Good. Did you have any flyers?
I have one flyer that I can
Okay.
share.
Anybody have any questions? Okay, I think that you all had at your spot, one of the things that we had discussed was the fund balance for the 112 and 109 funds. And so what I had done was I had asked Ms. Dreyer to kind of give us a little summary as to what the fund balance is currently and then what the projected fund balance is, because the levy was, that part of the levy was reduced considerably for this year. And so that they're going to use 1.4 million of fund balance. And we have a couple of big projects. One of them is a estimated $600,000 for a generator for the refrigerators, so that in case the power goes out, that we don't lose our vaccines. And then we also have the mobile van that's going to start up next year. So we're looking at maybe some good expenses there to do a lot more outreach into the rural communities. So that's a lot of the fund balance used for 2024. And so then I asked her to look at 2025 to project out what that would do to, making some assumptions, which we know that we can't count on them to be totally correct, but just making some basic assumptions, and then what the projected fund balance would be at the end of 2025. And the target that we have, the Board of Health determined, was about 1.5 million, which is about 15% of the overall budget, which is pretty much, standard accounting practices. So that's how we're looking at that. So that was just this informational item that I know that we had talked about for many years at this committee and at the Board of Health. And so I wanted to point that out to all of you so you see where we're going with that. So, and if anybody has any questions, you can ask me or Ms. McKnight. Any questions on that? Okay, thank you. Next up is Tim Wiley, Nursing Home Administrator. You have 2 items for action. First is request approval of nursing home private pay rate for 2024. Do I have a motion? Motion by Byrne, second by Johnston.
Hello, everybody.
Hi.
It's just a 2% increase in our private pay rate over last year. It's pretty standard.
Okay, anybody have any questions? No? All in favor? Aye. Any opposed? Okay, that's approved. And the second is request approval of a nursing home hospice services agreement with Loving Peace Hospice Incorporated, doing business as Gentiva. Motion by Hanson, second by Johnston.
This is just another hospice provider that would like to be involved in our hospice unit. Pretty excited about it.
Okay. Any questions? How many hospice providers do we have now?
This puts us at 5.
Go ahead.
Thank you. My question was more about capacity for hospice. With 5 providers, I guess my question is, how much more room do we have?
What these providers do is just offer an additional option to residents and family members, as opposed to an impact on our total volume. Hopefully it will help if they were to have some folks who were receiving their hospice care at home and it became too much for them at home, they could make referrals to us. But we feel like this is a good provider, has some of the offerings that we would like to see made available to our residents and family members. And it just gives us another good option.
Okay, thank you.
Any other questions? At this time, I'd also like, you want to talk about your report first? If there's anything you want to say in your report.
There are a few things that I'd like to highlight there.
Oh, didn't we do that? Oh, okay. All in favor? Aye. Any opposed? Okay. Now, I guess you can talk about your report.
First of all, from a census standpoint, I was excited to say that we had our 5th straight month with overall census over 100. I'm a bit superstitious bringing that up, but we're hoping that trend continues. And then while overall we served 26 hospice residents in Serenity Lane, at one point in the month of, early in the month of October, we hit 31, which is the highest that we've had since I've been there, and that was an exciting number to reach. You see the agency utilization for September remained at 15%, but give you a little preview into October, it hit 11%. So we're seeing that start to trend down even more. Under budget management, item B, I broke out for you what of our expenses were actually covered by relief funds. So when you see that our overall expenses were, I believe, at 11% over budget, $352,437 of that was covered by relief funds, but it was still run through our general ledger. If I subtract those, our expenses are actually 7% over budget through September 30th. And then if I move on to page 51, I've added a flow of our agency utilization so you can see how it's trended through the year. When you look at total CNA shifts and total nurse shifts, you'll see that some months are higher than others. That's strictly because some of the months included 5 weeks of staffing and the rest included just 4 weeks. But this will kind of give you a picture of how the utilization trended throughout the year, if that's helpful.
Okay, thank you. Questions on his report? I like the fact that revenues are 8% over budget and expenses are only 7% over budget, so that's good. Anybody else have any questions?
Just the one question about the aging accounts receivable. Is this still the internal, like the in-house collections that you're doing, or is this the group that we had contracted with?
What you see posted here is from the contracted group,
The 15,000?
yes.
Okay.
Which is an indication that a lot of the low-hanging fruit, we were able to take care of that early on.
Right.
I can tell you that we have, I don't know what the number is, but just in speaking with our biller, with Rhonda, we have quite a bit of money coming from VA.
Okay.
Just for some things that they needed to fix on their end. So that will show up probably in next month's report. But we're getting it down to where what we can take care of internally has, a lot of it has been addressed.
All right, thank you.
Okay. At this time, I'd like Ms. McNeil, the treasurer, to come up too, because we had received this in an email and we also have it here to talk about her report on that she presents to finance. Thank you.
Thank you. Thank you for giving me an opportunity to present this to you and discuss some of the things that I think will be important. As Mr. Wiley indicated, here in 2023, there's been a lot more activity at the nursing home. And I do have one report that I didn't email because I put it together afterwards, but I'll pass it out. But if you look at the at the end of the third quarter, the year-to-date revenue accrued to the general ledger is $8,250,000, and year-to-date expenses accrued to the general ledger are $8,524,000. The number that I am presenting to you today includes the September revenue. Just for clarity, the auditor's quarterly report was ran prior to that September revenue being provided, so it could be booked to the general ledger. So if you do look at the auditor's quarterly report for the end of September, you'll see numbers that look much different because they're missing over $800,000 in accrued revenue. Okay, so please keep that in mind. As far as the monthly revenue that's been reported to the treasurer's office, you can see that throughout 2023, the revenue has been pretty consistent, hitting the $800,000 to $900,000 mark. That's a huge improvement over prior year. This right here, if you want to pass this. That is a huge improvement over prior year. You can see on this report as it comes down to you. And I'll wait just a second. So after the third quarter of 2023, booked to the general ledger and Fund 0401 is revenue of, again, $8,250,000 and expenses of $8,524,000. If you look at the prior years, revenue was consistently lower, substantially lower. than the 8.2 million. Expenses were also lower, but there was a much wider variance also between the revenues and expenses that were accrued as of that date. Just wanted to point that out, that obviously the increase in revenue is relative to his numbers, his increase in census and his increase in services. But of course, when you have an increase in your census and your services, then you're also going to have an increase in your expenses as well. The receivable on the general ledger at the end of September ended at $4,182,000. Cash at the end of September is negative $1,149,000. And fund equity at the end of September was $1,077,000. Just wanted to give you an update on where the general ledger stands at the end of the third quarter.
Thank you. Anyone have any questions? Okay, Mr. Wiley. Yes, you can ask a question. I mean, because we know that some of this timing is off
Yes.
on these things, and so like your report numbers aren't necessarily gonna match her report numbers because of the way things function in accounting, which is way beyond my expertise.
My only question is regarding expenses for 2022 and 2021. These, if I remember right, do these expense numbers exclude any expenses that were paid by relief funds?
Anything that was paid out of 0163 is not part of 0401.
Okay,
This is only strictly the activity that rolled through Fund 0401, which is the enterprise fund.
whereas in 2023, we started running the relief fund revenue and the relief fund paid expenses through the general ledger, just to bring that to the committee's attention.
Right.
Which
That
would,
is a good point. Thank you for mentioning
which
that.
would explain the significant difference in expenses from 2021 and 2 compared to 2023.
Yeah. So I think that and this was something that I'd pointed out to Tim also, was that when you look at those expenses that used to run through 0163 over the last, was it 2 years? Those expenses are now running through Fund 0401. Okay? And so, in my opinion, the fact that those expenses are running through Fund 0401 and you see the revenue, the increase in revenue to Fund 0401, that's substantial, the increase to revenue in 2023 in Fund 0401. Obviously, if those expenses were still running through, some of those expenses were still running through the ARPA fund, you would be seeing a much different picture as far as the difference in your revenues and expenses. You would see a very positive picture in your revenues. So I think that Mr. Wiley has made tremendous improvements, and there's still work that's being done. It's very encouraging to see this revenue number jump up as much as it has.
Yes, we like it too.
Yes, yes. And the other thing, when we look at that fund equity, please, I remind Finance Committee this all the time. The difference between the fund equity in 2022 and 2023, keep in mind that at the end of 2022, upon the advice of our external auditors, we set aside a large amount, $2.8 million in reserve for bad debt. Not as they sort through the receivable, this money essentially has been set aside in case we need to write some of those receivables off, okay? So that 2.8 million is still sitting in a reserve. According to governmental accounting standards, it comes off of the fund equity, but it's still out there. And if it's not utilized for bad debt, then we'll roll that back into the fund equity. So I just want to remind you of that reserve that has been set aside.
Thank you. That's an important point, to know that that's still there and that we haven't done anything with that yet. Anybody else have any questions? I appreciate the time that you've taken with this, and appreciate Mr. Wiley's work on really turning the nursing home around and serving the people in this community that need it, so. Much appreciated. Anyone else have anything for Mr. Wiley or Ms. McNeil? Okay, thank you. Next up is the County Administrator, Ms. Taylor.
Thank you, Chair Schaefer. I have no items to present for action. I do have one item to present for information to the department heads as well as any board members that have an active McLean County email that are KnowBe4 cybersecurity trainings that are required to maintain part of our internal system are required to be completed. I think we have another month to do that. And then also the sexual harassment training that's required by the state of Illinois has been sent to you via email. So please complete all of those trainings in a timely manner so we can maintain our compliance.
Thank you. Under other business communication, our next meeting is December 7th, Pearl Harbor Day. And then our 2024 meeting dates, I want to make sure everybody realizes that July 1st is the outlier, because we don't want to be here on the 4th of July. And so otherwise, this is the first time I think Health Committee has only had to change one date for the next year. So I'm kind of excited about that. We can be kind of regular. Does anybody have anything else that they'd like for the committee? Nope. All right. Thank you. We are adjourned.